It's Brian Neiman and C4 as we continue our discussion this morning about a whole slew of topics regarding the coronavirus. We're pleased to be joined now by Dr. Timothy Doran, who is a pediatrician and chairman of the Department of Pediatrics at GBMC. Great to have you on. We always appreciate you coming on the show with us.
Nice to be here, Brian.
You know, we talked with Dr. Bailey, who didn't seem to be sold on kids going back to school right now, thought maybe e-learning was best, but the American Academy of Pediatrics is saying, yes, it is safe for kids to return to school. They think that kids should be in the classroom as much as they possibly can. What do you think as a pediatrician regarding kids in schools, in-person learning specifically?
Yeah, Brian, I think the Academy actually would, I think their wording is they would strongly advocate that all policy considerations start with a goal of having students physically present in school. So, I mean, that is the goal. I mean, we know that school, as pediatricians, we know how important school is in many, many areas, especially for our disadvantaged populations. That would be children with disabilities, but also poor and children who are in school districts that don't have the wherewithal that other school districts would have. So this is an incredibly complex and difficult decision about school openings. But yes, we would love to see students back in school, but it really gets back to how we manage the epidemic as a general population, which we have done extremely poorly at.
Dr. Timothy Doran is on board with us. He's the chairman, Department of Pediatrics. You're listening to the GBMC Healthcare. You're listening to the coronavirus. It's our fourth virtual town hall meeting with GBMC Healthcare. And Dr. Doran, when it comes to schools eventually they're going to be back in school, the kids will be. What do parents need to do now to prepare for that? What are some of the things you would suggest?
Well, I mean, it's certainly that we will be back in school. I mean, I'm pretty confident that we will have a successful vaccine. I think that what parents have to have expectations that there's going to be a gap in learning. So, and that's going to be pretty significant. I mean, the virtual learning that's going on now is important, but it does not replace in-person learning in school. We know that with some degree of certainty, and the younger age groups probably more of an issue than middle school and high school. But I think that parents have to have expectations that there's going to be a need for some catch-up time. Curricula will need to change in order that we can't expect students to be in the same place 6 months from now if they've been at home for 6 months. So I think whatever they can do at home is important. With the parents that I see in my practice, they have a profound appreciation for what teachers do. I think that's been one good aspect because teachers are incredibly important for our society, for our children, and for all of us.
The number of kids who have contracted coronavirus is low, right? And the spread is low. The deaths are extremely low. Why is that? And is there the evidence that the transmission just isn't as common among children, either children to children or children to adults? What do we know about that and why, Doctor?
Yeah, that's a great question. So we do know that children do not get this illness as often as adults. We also know that when they get this illness, they're not as sick as adults. And we also know that the mortality rate is very, very low. We think that's because this particular virus, this coronavirus, actually attaches to certain receptors mostly in our respiratory system and in our GI system, but mostly respiratory system, and that children just don't have these receptors in the same number that you do as you get older. That as you get older, you actually increase the number of receptors you have, so therefore you're more susceptible to getting ill, and when you get ill, you're more susceptible to becoming extremely ill. That's the theory. We don't know that for sure, but that's the best sort of guess. In terms of transmission, though, it's a little bit unclear because we don't know what the effect is of children who are asymptomatic, not pre-symptomatic. Pre-symptomatic meaning like the congressman who came down or is tested positive. He was perfectly fine 2 days ago, and then he tested positive yesterday. With asymptomatic patients, they never have symptoms, so they can have the virus and spread it without anybody knowing that they're sick. But we do think there are studies, one recent one out of Korea, and other studies that seem to support the fact that children don't transmit the virus as often, whether they're lower to the ground or whether they're breathing and doesn't extend out as far. We're not sure of that, but that's the prevailing opinion right now.
Dr. Timothy Doran is on board with us from GBMC Healthcare. He heads up their Department of Pediatrics. And when it comes to the mask wearing, once again, I'm thinking about when kids get back into school, Dr. Doran. When it comes to the mask wearing, they're going to have to wear these masks for many hours during the school day. Are there concerns about that?
No. So
okay.
The only issue is going to be, I know the governor mentioned over 2 years of age. The 2 to 4 to 5 year olds are really not going to be able to. I think it's going to be pretty much impossible to keep them in masks all day. But once they're in elementary school, other countries have done this successfully, and there's no adverse effect for the children to wear a mask, and they should be wearing a mask. The countries that have done this successfully, the children are masked. They're distanced from each other, and they're hand washing and the improved hygiene in the surfaces as well.
All right. The big problem too right now is obviously if they're not in school because of the summer, and if they don't go back again in the fall, it's a full year of not being in school. And you talked about the disparities, obviously, with minority students and poor students. So at what point do we say, we got to make sure that they are actually learning something? Like, do you have a line where you draw and say, maybe we need to repeat a grade or we need to get extra help for students to make sure that they're actually, advancing with their education?
Yeah, and Brian, this is one of the big issues for school administrators and superintendents across the country, and really not even across the country, all over the world. I actually read a number yesterday that in the last, since mid-April, 192 countries closed schools, and that's 1.6 billion children in the world. Think of that number. So we're just going to have to be flexible and adapt to the fact that these children are going to have a gap in their learning, and they're going to need to adjust curricula to reflect that. And it is what it is because of the pandemic. But the big thing we need to do is, and I just heard on your news report before this segment, is a call to have a reset on the pandemic, because where we are as a country is yesterday I looked at the numbers last night. Italy had 200 cases in their country. They were at the same point as we were in March, and we're having 50 to 70,000 cases a day. So obviously other countries have handled this pandemic and have handled it really well. Germany had 500 cases yesterday. The Scandinavian countries are down in the low numbers. So we have to, as a country, if we want our children back in school, part of that, and I think Dr. Bailey mentioned this, is that we need to control our outbreak with some. We need to rethink our whole approach. It needs to be federal and state and local together in one unified approach.
Dr. Timothy Doran, I've asked you this before related to parents because, a lot of the pressure right now on parents to deal with, financial pressures, and now no in-person school. They have to figure out what they're going to do with their kids. Children feed off their parents' kind of pressure and emotion. Just talk about for a minute that pressure that parents are going through right now with their kids. Yeah,
and I see this every day in my practice. Parents from all walks, because I see everybody from very poor to very wealthy, and they're all suffering. I mean, they all are stressed. Many families have parents who are both working, trying to work at home and manage their children, and it's really difficult. But the answer again is to try to bring our frequency of community spread to a point where we can get children back in school. We certainly can get the younger children back earlier. I think that's pretty universally agreed upon, and the National Academy of Science, Engineering, and Medicine, the CDC, the Academy of Pediatrics, all speak to being able to get the K through 5, K through 5th grade, get those younger elementary school kids back in school. And when you do that, you're going to have to accept that there are going to be some cases in both in students and in teachers, but you have to weigh that against the damage you're doing by keeping kids at home, whether that be from child abuse, whether that be from food insecurity because they're not getting their meals at school, whether they're not getting the mental health and physical support they're getting in schools. It's pretty profound. And I think schools have to be very transparent about the fact of what they're going to do with when these members of their community come down with COVID.
Yeah. Dr. Redfield talked about, the head of the CDC, talked about teens and suicides and drug use being up. We'll let you go on this. I always try to end on a happy note, and that is, is it possible that because we're going to be wearing masks and because we're doing the social distancing thing, everybody talks about that second wave and the flu at the same time, that because we're doing all these precautions, that the flu may be not as bad because we're wearing masks and we're washing our hands more and, the kids aren't in school? Is that a possibility at least?
Absolutely. We know that already from when it when the pandemic first appeared in March, that the incidence of other respiratory illnesses went down, and we would expect that with hand washing and masks, et cetera, that the flu will be much less severe than usual. And it also depends on which flu strain comes around this year. I mean, different strains have different abilities to disrupt our schools, so it's going to depend on both. But clearly, hand washing, masks, distancing will absolutely decrease the amount of flu in the community.
Very good, Dr. Doran. Great to have you on. Thanks for your time.
Great to be with you guys.